My name is Amy Schulz. I am on the faculty at the School of Public Health at the University of Michigan. Delighted to be joining you today as the facilitator for the latest in our Residents and Researchers series of talks. These talks are organized by the Community Engagement Core of the M-LEEaD Center in collaboration with the IHSC Core. What we do in these sessions is feature innovative and important work that's being done by researchers working collaboratively with residents of communities that are facing environmental challenges. So we have an exciting panel today and that I will be introducing in just a moment. Before we begin, I want to acknowledge that those of us who are at the University of Michigan are joining you today from the traditional homelands of the Three Fires Confederacy of the Ojibwe, the Odawa, and the Potawatomi, along with a number of neighboring tribes who cared for and lived on the land from which we are presenting for many generations. That land was ceded to the University of Michigan, and in the hope that the children of those communities would be able to be educated at the University of Michigan. And that is a promise that we have struggled to recognize for many generations. It's especially fitting that we are talking about water rights today, the topic of our panel, the day after Indigenous Peoples Day. In Michigan, there were 8 main treaties signed which ceded lands from tribal communities to the federal government. And those treaties contained important protections for water rights. They are currently threatened on multiple fronts in Michigan, including through the extraction of groundwater in mid-Michigan for sale as bottled water, and by the Enbridge Line 5 pipeline across the Straits of Mackinac, just to acknowledge a few of the challenges to water rights in the state. This session is part of a series that we're doing featuring and thinking about what it means to name racism as a public health crisis. Many of you know that over the last year or more, about the last 2 years, a number of cities, counties, and a few states, including Michigan, have issued declarations that are declaring racism as a public health crisis. We're doing a part of a series here in conjunction with a number of collaborators who will acknowledge at the end, really trying to dig into what does it mean to name racism as a public health crisis? What does that look like? And what are potential actions that could be taken to address those issues? For those of you who are interested in additional information, the American Public Health Association has a very nice site that recognizes and examines what some of those declarations look like. Today, we are in particularly going to be thinking about water, and water as a human right, and the way that right is differentially distributed across racialized groups within the United States, and what are the implications of that for public health. I'm really delighted to introduce our panelists today. Our topic is water and public health. Our focus will be on inequities and affordability in the United States. And the panelists that are going to be speaking to us today on this panel include Monica Lewis-Patrick. She is the president and CEO of We the People of Detroit, which is dedicated to community coalition building and the provision of resources that inform, train, and mobilize Detroit residents, in particular around water access and affordability. We're also joined by Mary Grant, who is the Director of Public Water for All at Food and Water Watch. In that capacity, she works to assure the human right to clean, affordable water, public ownership of safe and affordable water systems, and working to end the practice of shutting off water to residents who rely on it. Our third panelist is Dr. Marcela González Rivas, who is on the faculty at the Graduate School of Public and International Affairs at the University of Pittsburgh. Her research revolves around sustainable water policy, equity, and water governance, and she has published widely on this topic in both in domestic and international contexts. I want to particularly thank Dr. González Rivas, who is joining us when taking time away from her class. And she is going to be leaving us just a few minutes early to get back to her students. So thank you, Dr. González Rivas, and thank you to your students for sharing you with us today. Okay, so I am going to stop sharing my screen here, and I'm going to turn it over to our panelists for our conversation today. And I want to start by asking Marcela, if you would start by giving us a little bit of background on water for affordability in the United States and the impacts of increasing water costs for United States households.
Sure, it's such a pleasure to be here. Thank you for the invite. So I'll just give you a general few things to consider when thinking about water affordability and why it is such a growing problem. And it is a growing problem in the United States, as you know. So across the country, communities are facing rising water rates, which are becoming unaffordable for many households. Several studies have found that water bills have been increasing rapidly for more than 2 decades, even as household incomes have stagnated for most of that time. And poor households are paying a large share of their income on water bills. So this is significant. And the rising cost of water services has severe impacts for households, including obviously the loss of water access due to forced shutoffs, which have important health consequences, of course. But not having access to water has other impacts as well, like individuals and households face further economic hardship because they have to miss work or school, having to secure water. And these, again, causes mental stress. So it has severe impacts, not only for public health, but also economic hardship, and that feeds back in the loop of sort of health effects, right, for households. Now, unaffordable water bills can affect people everywhere, right? But the evidence shows that these impacts are not evenly distributed. Lower income communities and BIPOC communities, Black, Indigenous, and people of color, are especially hard hit. And to make matters worse, the US does not have a permanent federal program to protect water access. This is in contrast to the energy sector that has a low-income assistance program that has been running for 40 years. So in response to this growing problem of water affordability, communities are organizing around the issue of water affordability and the human right to water in general. Local water advocates have taken the fight for affordable access to water to city halls, state legislatures, Congress, courts, and the streets. So for example, in Pittsburgh, where I live, a diverse coalition called Our Water Campaign, composed of local residents and various organizations of different types like environmental, labor, advocates for affordable housing, etc. They got together, committed to making access to safe and affordable water possible. And they called for a moratorium on shutoffs, but also to put in place affordability programs for low-income households. But they also advocated to keep water publicly owned, which is an important aspect of water affordability. And I'm just going to leave it at that, Amy.
Thank you for that important background and those framing comments. I want to open the floor now to Monica and Mary, who I know are going to have a little bit more to say about that issue.
Well, definitely, what I would share, and I really appreciate Dr. González Rivas. Her work has been critical in terms of validating what frontlines have been saying for decades in places like Detroit. And so one of the things that I would love to lift up is the fact that Detroit has been that canary in the mine in terms of what not to do to make water unaffordable and inaccessible. And so one of the things that we saw repeatedly is that since the late 1990s, it has been Black and brown and indigenous and poor white women that have been working together, not only in Detroit, but across the Great Lakes and the nation, really to get to this critical moment of advocacy where others are hearing and amplifying those talking points that water shutoffs, unaffordable water rates are creating a public health crisis, and that much of that divestment is based in institutional and systemic racism. And so one of the things that we did at We the People of Detroit is to build off of that legacy of those Black and indigenous and brown women to build what we call the Community Research Collective, where we brought together community leadership and expertise with that of researchers similar to what you just heard from Dr. González, to join ranks with intermediaries, but also asking the question, is water affordable? Well, when you look at places like Detroit, where water rates have gone up over 478% over 2 decades, but you have not seen incomes keep pace with that, where you know that the demographics of the city is that 40% of the city lives in abject poverty, and that 60% of the households in that city are headed up by women of color that have anywhere from 2 to 4 children and that are working outside of that city. When you see that there are entire neighborhoods shut off from water, and even for the more affluent neighborhoods in Detroit, like East English Village, they are finding it a struggle, at least 30% of that population, to afford their water. And the other thing that does not often get lifted in this moment that is still on the backs of Detroiters, even though we had the largest, what we consider a contrived bankruptcy, because it did not alleviate the burden and the legacy debt connected to that water infrastructure, is that Detroiters are paying an 83-17 split for the combined sewage overflow for about 78 municipalities and townships, even till this day. So that burden alone is going to continue to put Detroiters in threat of not only being unable to afford their water, but also in threat, what we know in Michigan is that if you don't have running water for 72 hours, you can lose your children. So all of these are things that become a very dangerous element when we don't look at and humanize water affordability, water accessibility, and the human right to water.
Thank you, Monica, for giving us some insight into what that looks like on a very local and a very personal level on a day-to-day basis. So thank you for sharing that. Mary, I wonder if you want to say anything on this point from your perspective at Food and Water Watch.
Sure. I just want to lift up Monica and We the People of Detroit have an amazing cache of research. I think one of the most, what I love maps. And so they have an amazing mapping the water crisis in Detroit. If you haven't seen it, I recommend checking it out. So I would want to just circle back to the connection between water access and housing stability, because there, as Marcela mentioned earlier, there's these violent collection practices, the shutoffs, but also tax sales of homes and evictions. So people are losing their homes and being forced out of their homes because they can't afford their water bills. And the scale of the crisis is, like Marcela and Monica said, is very large. One study found that the average low-income household is paying 12% of their disposable income on water and sewer service. 12% of your take-home pay just for water and sewer. That's, by any metric, unaffordable and unsustainable. So a lot more work needs to be done to really address this issue. And I think we need to fundamentally change how we view water and how we view paying for water access. There's this mantra that's been pushed by the federal government and EPA that we need full cost pricing, that the entire cost of services are reflected in water bills. But water bills are just incredibly regressive. They're one of the most regressive bills you pay. So we need to, counter this austerity that we're seeing from the federal government and push for more funding that directly helps out households locally.
Thank you, Mary. I'm going to stay on Mary for just a moment here and move to our next question, which Dr. González Rivas already alluded to this, but I want to shine a little bit more of a light on this. During the pandemic, there were a number of states, not all, that put some protections in place for water access for their residents. And they did that by placing a moratorium on water shutoffs. And I wonder if you've done some very nice work looking at the implications of that for the spread of the pandemic, and what would have been the implications had more states created similar moratoria. So I wonder if you could talk a little bit about some of those protections, what their implications were for the spread of the pandemic, and also what's currently happening with those as we are, as some people are saying, drawing to the close of the pandemic, although of course that is an open question. So go ahead, Mary.
Yeah, well, thank you for the question. I'm going to share my screen. I have a couple slides about some of these studies. So you probably remember at the very beginning of the pandemic in March 2020, before we knew much about COVID-19, the CDC's main advice for people was to wash their hands to protect themselves. But people can't follow that simple advice when their water service is disconnected. Before the pandemic, about 15 million people experienced a water shutoff in a typical year. On this map, you can see where the highest rates of shutoffs are. They're concentrated among the largest cities. So they're concentrated in the South and the Midwest. These are where people were denied access to water because they can't afford their utility bills. So the global health emergency of the coronavirus pandemic not only shone a light on this silent crisis, but it ushered in a new wave of water protections that we had never seen before in the United States. That wave actually began in Michigan, in Detroit. So on March 9th, 2020, because of the activism, advocacy, and education of Monica and the amazing team at We the People of Detroit, as well as the People's Water Board and many grassroots organizations, Detroit was the first city in the country to pause shutoffs in response to the pandemic. And that actually started the groundswell of action that we saw across the country. Hundreds of local governments and most states actually stepped up to ensure people had water that they needed to wash their hands to protect themselves, their families, and their communities from the spread of disease. So at Food and Water Watch, we captured more than 800 local and state moratoria in our public database. Interestingly, Drs. Warner, Zhang, and Professor González Rivas used that database to look at where these moratoria were being placed. They found that they were most likely to states were more likely to impose moratoria if they regulated private utilities and if they didn't have uniform Republican control. Cities with more people of color and with more income inequality were more likely to impose moratoria, which is a very good thing. So because of these protections were very short-lived, one only lasted a month. And by December of that first year, 2020, most of the statewide moratoria had already expired. You can see on these maps, the first one is the states with moratoria as of May 2020. The blue states had moratoria. Those dashed lines indicate that they're comprehensive, so they're applying to both regulated and unregulated utilities. The pink states never had a moratoria. The second map shows the states with moratoria as of December 31st, 2020. So by the end of the year, the expired ones are the light blue color, and then the dark blues were the ones that still had the active moratoria. So only less than a dozen by the end of the year still had an active moratoria in place. And so what was the impact of these, albeit short-lived, protections? Well, we worked with Dr. Zhang and Warner from Cornell University on a study that looked into that. And the top line findings were that water shutoff moratoria were associated with significantly lower growth rates in COVID infections and deaths. This is after accounting for other policies like mask mandates that also improved outcomes, as well as for insurance access and demographics that can confound results. It was projected that a nationwide moratorium could have prevented, if we had a nationwide moratorium, we could have prevented 500,000 COVID infections in that first year, 2020. That's 4% fewer infections. And it was projected that a nationwide moratorium might have prevented 9,000 deaths from COVID-19 in that first year. So that's 5% fewer deaths in that first year. So I'm going to put in the chat for everyone, or I'm going to put in the, hopefully we can share the chat with everyone. I'm going to put in a link to the a study in a journal where you can look at more of this in the American Journal of Preventive Medicine. And then a second link is our more popular digital format of the study, which is more for a general audience. So still today, we know that hand washing remains one of the most important ways you can help protect yourself from the spread of many viruses. The benefits of maintaining water access, as we talked about earlier, go beyond hand washing. It also enables people to stay safe at home. So when people experience a water shutoff, they can rely on neighbors or relatives or public places to access water. And even outside a pandemic, water shutoffs, as we said before, pose real threats to human health. Without water, you can't flush your toilet. You can't bathe. Imagine a senior living in a home with unflushed toilets. Imagine new parents being unable to wash their hands after changing a dirty diaper. So as International Hand Washing Day is actually this Saturday, October 15th, we need to really commit ourselves to work for structural changes that would keep and turn safe water on for every person in this country and around the world, because no one should be denied access to water over an inability to pay. Water and sanitation are basic human rights and needs. They're essential for living a life with dignity, but very few places in the United States still have protections in place today. A few cities do, but that's only because of community organizing, grassroots activism. Baltimore hasn't performed shutoffs in the last 5 years and has codified vulnerable population protections. These are protections modeled off of what we, the people of Detroit and the People's Water Board, proposed for the state of Michigan. Baltimore actually codified them. Chicago recently moved to ban water shutoffs too. Detroit has claimed that its moratorium would last to the end of this year, but I've heard from some folks that that might not be true. So maybe Monica can fill us in more.
All right, Monica, let's hear from you on this topic, and don't forget to unmute.
No, thank you so much. That was a perfect segue into just where things are. One of the things we often like to talk about, and Mary's been instrumental in helping us bring this historical context to bear, is that our water infrastructure has been divested from for about 50 years. And so you're seeing the results of years and years, decades and decades of divestment from water, which initially the whole reason for the US government investing in water infrastructure was for the purpose of public health. And so then as we saw that divestment, much of what we saw happening in urban cores across this nation is that you saw that divestment shift from the federal government contributing about 67% of the funding that went toward water infrastructure to now only contributing about 7 to 9% of the federal budget toward infrastructure. You also saw that shifting in that budgetary shortfall go from the state to the municipality at the local level to the individual ratepayer. And so, as I stated, for many ratepayers, we have not seen our incomes keep pace with the ever increasing cost of our utilities in general, but water specific. But the thing that we really had to do at a local level, because Mary mentioned, Detroit has been the canary in the mine in terms of what has been failed government and non-successful water equity. But we have also had amazing leadership and innovation from the front line create policies that do demonstrate equitable and human rights concepts for how we can move water in a just and equitable format. And so true lifting up the women of Michigan Welfare Rights, all of the major Black matriarchs that I serve with at We the People of Detroit. But there was also legislative champions like the legendary figure, Mary Ann Mahaffey. And there was great leadership from the great Dr. Joanne Watson. And what those women knew is by being able to use the human rights framework for water affordability, it could help us move forward the human right to water. And so when we were able to find out that from Michigan State, that Elizabeth Mack, along with other professors, had actually sounded an alarm in 2017 that we were going to see by the year 2022, 35.6% of the nation unable to afford their water. We were already experiencing this in places like Detroit, Flint, Benton Harbor, but also across the region of the Great Lakes in Toledo, Cleveland, Cincinnati. So there was devastation happening at a massive level that was going undocumented and unnoted because many utilities aren't obligated to report out how many people are being shut off and then how many people are being restored. The next one, please, Allison. And I just want to go through a couple of these. It was so important during COVID, and this is one of the things I want to lift up that was instrumental in terms of the collaborative spirit of many of us that understood that we as a community and a nation were at risk. It was the brilliance of Mary and others at the national level in terms of beating those doors with policymakers and helping leaders like Rashida Tlaib and Debbie Dingle and Brenda Lawrence actually raise the concerns, not only for Michigan and the Great Lakes, but what was happening across the nation with public health. But a second piece that was really important was at the local and state level, because the University of Michigan with Amy and others at that table were able to help us translate critical information into multiple languages. You were a critical part of being able to help us create infomercial material to be able to disseminate very complicated information very quickly around what COVID was doing and best ways to remediate with hand washing and sanitation. And so even as we were trying to create the political power and will at the local and state level to at least put a moratorium in place, it was so important that we also were able to demonstrate the care for one another at the local level to just make sure that people had the water relief they needed, making sure that they understood the proper sanitation that was needed in that hour. And so I'll stop there because I want to make sure that others can jump in, but I just want to be able to demonstrate that at every juncture, we had to use everything at our disposal, not only the power and the brilliance of the professor in terms of what happened with Cornell to lift up that shutting off water was creating another multiple layer of public health crises, but it was also using the platform of the university to demonstrate that they not only use their expertise to help us get information out at the local level, but they use their ability to convene to have this important conversation.
So I am going to take the opportunity that the door that Monica just opened wide for us here to move us to our next question, which really is about the process of creating community and academic partnerships. We've talked a lot about this. We had a good conversation about it as we were prepping for this panel, and I know everyone here has a lot to say about this. We know that partnerships between community residents, community leaders, and academics can be fraught. They can be fraught with political and power imbalances. They can be fraught with differences of agendas, which can, even when there are the best of intentions coming into the partnership, that they can get in the way sometimes of the work that needs to be done together. And I'm going to invite Monica to speak first to this, but I do know that that the other two of you have had a lot of experience within such partnerships and a lot to say about this. But Monica, I wonder if you could start us off by talking about what is important about community leadership in those partnerships, and how have you gone about the process of creating effective working relationships with researchers to move forward the community organizing and shifts in power that are really central to this work.
Thank you for the question, Amy. And it's such an important part of the work we do at We the People of Detroit. We enter this work centering our community, never assuming that we know what's best for our community, always moving in a circle of checks and balances and accountability, never afraid to speak what is so based on what we're experiencing and seeing. We live in our community, so we are not separate from the very people that we're speaking of, but many of the experts are not the practitioners and statisticians and researchers that you note. It's really that voice of that big mama or that grandfather that sits on the porch and watches all the activity that happens on the street. Those are the people that, one, are shaping the questions that we are seeking scientific and data to be able to either validate or dispute. They also are driving the accountability in terms of how we shape and weigh in on policy. And then I think the critical thing that we have learned from amazing practitioners and And scholars like yourself, and also I would have to lift up Professor Emily Kudel, Dr. Nadia Gaber, Dr. Mona Hanna-Tisha, just those kinds of experts, the good Dr. González right here. I mean, that kind of intentional work, not so much to do research for research's sake, but doing research that is moving the needle for systemic change. That is the powerful moment that we're in. We need no more filling up the libraries with your pontification and your theories. We need work that is grounded in being able to be humble enough to lean into community, and yet brilliant enough to understand that your science and research and expertise are needed. And so I think that that's what we've been able to exemplify in terms of this moment of getting a national moratorium, at least attention to it. No one can ignore at this point that we don't have a national crisis around water affordability. Now the question is going to be, are we willing to get in the room as some of the best minds in the nation and actually usher in our lifetime, clean, safe, and affordable water?
Thank you, Monica. And Dr. González-Rivas, I am very aware that your students are waiting. So I am going to turn to you next and invite you into this conversation.
Absolutely. I mean, this is really incredible. Monica, thank you for saying exactly how it is, because I think I can only speak from the side of the challenges for researchers and academia, because the structures are such that in order to really be able to establish the types of partnerships that Monica is referring to, that really are a collaboration, and increasingly there's a really more interest in the university and academic circles to do community engaged research. There's more and more funding opportunities to do that. They really are looking for components of community engaged work as part of research. But the structure of the academic institutions and the incentives set up are not changed. And so we need to recognize that not all disciplines have the knowledge and understanding on how to conduct these partnerships ethically. We need to establish real collaborations to understand that there's value in all sorts of knowledge production, which is exactly what Monica was saying. You need to hear the voices of the community because they are living, they experience, and that is knowledge. And that is the only way to really generate that systemic change that is needed, right? And so establishing these partnerships takes time. There needs to be transparency, there needs to be clarity and expectations, and recognition that there's a history of extraction from communities, from the universities, for the very universities. And once we understand those power dynamics, I think it's essential to generate work that actually benefits communities as opposed to research for the sake of research, like Monica was saying, and really, of course, still with adhering with the rigor and with scientific rigor that demands, right? Because it's only essential in order to really generate that impact. But we need to recognize the complex and the history of these partnerships.
Thank you very much. Mary, would you like to chime in on this? I know you've been part of a number of partnerships with academically based researchers and have done some really powerful work. So would welcome your thoughts.
No, I agree completely with what Monica and Marcela said. You need to listen and believe community experiences. I mean, I'm going back to like what happened in Flint or at Benton Harbor, where residents like knew that something was wrong with their water, but officials ignored them. There were even, consultants or scientists saying that it's completely in compliance with all federal guidelines, so it's safe. I don't know if folks remember that back in 2014, the complete dismissal of community voices. And so then again, like researchers and state officials trying to tell residents their water was safe even before lead service lines were replaced. So I think there needs to be more accountability and responsibility to the community when you're doing research, and also recognizing your power as a researcher with your academic credentials when you go in and speak in a community, that sometimes government officials give deference to you. So like recognizing that power when you're going into a community and making sure that you're not standing in the way of community voices. I'm just going to say this is also important for national organizations like my own doing policy research. For one example that I keep thinking about is that I've heard more than once how no one in a community affected by a disaster wants some white environmentalists in DC to dictate how relief funding is spent. They don't. I mean, come on. We don't want to have strings on how people can rebuild and restore their services after a disaster. So as we think about policies and research products, they can have, you've heard this before, you can have the best intentions, but it's the impact that really matters. It's actually addressing the concerns, or are you actually addressing concerns, or are you being used to silence the voices of people affected? And I think the best way to ensure that your impact aligns with your intention is being intentional about your collaboration with affected communities.
Thank you very much, you guys. I am looking at the time. We had a couple of additional questions. I think they had to do with how do we go about the process of creating equitable partnerships, and also why is it important for community leadership within those partnerships. Each of you have said a few words about that. I'm going to invite you. We're already seeing questions come into the chat, and I want to make sure we have a chance to get to those before we end. So just to give everybody on the panel a chance, if you want to say anything further about the process of creating equitable partnerships, which I think could fill our entire time if we let it. And also why the importance of community leadership. And then I am going to turn to a couple of really wonderful questions that we're getting coming in from folks in the audience. So any last words on either of those 2 points from the panelists?
The only thing that I would add is that we found it very effective and important to actually share ownership, co-authorship of the work that we are producing with professors and scholars. So that has just been an effective tool in terms of keeping that integrity and transparency in place.
Thank you, Monica. Any others? All right, so I'm going to turn to our first question, and this question is about rural communities. So the question is, do rural areas have policies that prohibit water shutoffs? Is that a reason why the water shutoff rates are higher in urban areas? I did notice on the map, looking at Michigan in particular, that there actually were quite a few rural areas of the state that were struggling with water access and affordability too. So anyone want to speak to this question?
Mary?
Yeah, so if this is about the map I showed you from our shutoff survey, so our shutoff survey was biased towards cities, right? We looked at the 2 largest cities in each state just to have a nationwide representation. One of the things we've really struggled with getting is good data on water shutoffs. It's been a long-standing problem that a lot of organizations have called for better reporting and collection of data. So we looked at the largest cities because it would be easier to get the data. So that was our own bias and our sampling, right? So I don't know about the rural communities and their shutoff policies. I do know that some rural areas rely on household wells. So more rural areas on household wells, that's less of an issue. So Monica, do you have more to say?
Yes, what we found from our rural partners is what it is Mary just stated is true. Many of them are on individual wells, but it's in their sanitation, their wastewater, where shutoffs are a possibility. And so that becomes a major burden, especially for those small communities where they have not been able to maintain the tax base to even keep up the basic upgrades of their utility. It puts them in major threat of having not only water quality issues, but access issues with sanitation.
Monica, maybe before we move to the next question, 2 questions related to that. I know in rural northern Michigan, there is a large scale extraction of groundwater for by a corporation. That bottles that water and turns it around and resells it. And I know there have been concerns about the impacts of that on the water table, which would have implications for people who get their water from wells. And I guess a second question, and this would be for all of you, has to do with concerns about groundwater contamination. We're very aware of this in Michigan related to PFAS, but there are other chemical contaminations that threaten groundwater. And it seems that those would have very powerful implications for people who rely on wells for their own water.
Marcela, do you want to respond first?
I mean, I just want to say a little bit about the size of community water systems and the capacity that exists. So in general, the larger the water systems, and this is true, actually, there's research about these everywhere in the world, but this is also true in the United States, which is one of the wealthiest countries in the world. We still have a water and sanitation problem in that there's a lot of water systems that, because of their sheer size, because they're very, very small, decentralized, and maybe serving rural communities, which many of them partially have wells, but some of them might rely on some sort of some system, because they're so small. Sometimes they're not regulated, or sometimes they're not adhering to the safety and water regulations that exist for community water systems of larger size. But because of that, there's also less technical capacity in those systems to maintain, upgrade, and sort of like meet those standards for water quality that are set up. So there's a big problem of inequities that way, and the money and the funding and the resources tend to go to those systems that are ready that have the projects ready with all the paperwork and background studies and stuff that are so burdensome and so difficult to get. So and we observe that is true in Pennsylvania, and that's probably true in other parts of the country.
Thank you.
But I think too, it's important that folks know we have been fighting to really band together across urban, suburban, and rural communities. And we have taken that fight to get more technical assistance funds from the federal government to the state. But of course, for those that may not know, the state revolving fund is the mechanism in which those dollars will then get to the local. And so we're at a critical juncture in terms of accountability and creating more transparency to make sure those funds get there. And so this is a great opportunity for students and for practitioners alike to weigh in during public comment periods on making sure that there is an equitable and just lens baked into how these dollars are distributed.
Thank you very much, both of you. I want to encourage others who may have questions to go ahead and pop them either into the chat or into the Q&A on the Zoom drive. And while you're thinking about what else you might like to ask of this amazing panel, I'm going to lift up our second question, which is from Teresa Landrum in Detroit. And this question is for Ms. Monica. Detroit recently introduced their water affordability plan Lifeline, which is a 3-tiered program where folks/households might be eligible for, which in your opinion, is this program beneficial or detrimental for folks that have had their water shut off and the many that are facing water shutoffs?
Well, first of all, let me just tell you how honored and privileged I am to get a question from the GOAT herself, Teresa Landry. She is a legendary figure and human rights and environmental justice advocate and leader in Detroit and on a national and global scale. But Mama Teresa, what I would say is that the Detroit Lifeline is a step in the right direction after ignoring and denying all of the harm and the health disparities that were created by massive water shutoffs for decades. We see it as a patch quilt of assistance programs. It is not water affordability because there is no sustained funding mechanism nor calculations baked in that will make it sustainable. It is a temporary fix. It is a way to leverage the LIWAP dollars to plug in a budgetary shortfall. We in Detroit have gone from collecting about 97% from our customers to about 77%. And so that budgetary shortfall, Mr. Brown is looking to fill. But what we also see it as an opportunity, and thank God for Amy and the School of Public Health being able to weigh in on the importance of this moment and really seizing the opportunity to shift the conversation. And so, one, acknowledging that we do have a problem of unaffordable water rates, and we have a significant part of our population that cannot afford to pay. But two, creating a three-tiered process where those at different levels of the income tier would pay a different rate structure. There is only funding for 18 months. The second part of it is we need more transparency and accountability from the water department in terms of who is enrolling, how they're qualifying, and then how long they're able to stay in the program under the current conditions. We also are concerned about the volume of water that's being allocated. We know that the city has used the allocation of 3 persons per household. We know that the national standard is more like 4 persons per household. They're looking at an allocation of 4,500 gallons. We believe that it needs to be closer to 6,000 to 8,000 gallons because we have multi-families living in single dwellings. We also would like to see the water department actually admit past harms. If we're going to talk about racial justice, if we're going to talk about reconciliation, if we're going to talk about changing the trajectory of the city from a past and a long past of harm to really moving in this forward direction, then we definitely have to have citizens oversight, and it has to go beyond the Board of Water Commissioners because those persons are selected by the mayor and not always representing the interest of community. But thank you so much for the question. We believe it's a good step, but it doesn't go far enough to create water affordability.
All right, that seems like a wonderful place for us to close, Monica, with those powerful words and call to action. I just want to lift up a couple of additional things that have popped into the chat. One person who said there, I have no questions, just thank you for this important work. And a second saying this is such a powerful and upsetting discussion. Thank you. And I think there is a question there that maybe if folks are willing to try to answer that by popping an answer into the chat. The question is 2 questions. Do you think making the link to racism as a public health crisis is a useful hook to move this issue of water rights and water justice forward? And we are close to the midterm elections. How much do you see supporting water rights being discussed as part of people's campaigns? So again, we are out of time, but those are really important questions. Thank you, Kathy, for submitting them. And I invite the panelists to go ahead and type a response in to the chat if you, I'm sure there's lots to say on both of those. I'm going to close us out by thanking our panel once again. This was a wonderful conversation. I really appreciate everyone making the time to have this conversation. And just want to lift up a couple of upcoming events that may be of interest for those on this session. Water-related events happening that are in October. The Healing Our Waters Great Lakes Conference is coming up in just a matter of a week or so. And also Imagine a Day Without Water, which Monica and her team have been very involved with organizing, is also coming up. There's links here for those of you who may want to register for those events. And then I also want to lift up the next session in the series that we are organizing on racism as a public health issue, which will focus on air quality and social justice and focus on the Gordie Howe International Bridge, which is in the midst of being built in Southwest Detroit. That event is coming up on October 22nd. If you're interested, please register soon. Slots are filling up fast. And then the final event that we just want to lift up here is an opportunity to view the movie Cooked, Survival by Zip Code, and have a chat with the filmmaker, Judith Helfand, and Kathy Leichter, who I see is on the call today. Thank you guys for joining us, and to talk a little bit about these issues beyond the scope of this very short session. Finally, I want to thank all of our funders who have helped to support the work that we're able to showcase today. All right. We are out of time. Thank you once again for our panelists, and especially Monica and Mary, who were able to share your thoughts and your expertise and your wisdom with us, and Marcela, who had to join us to go off and join her, or leave us to go off and join her students. Thank you so much, everyone.